Hi, I'm Dr. Minati Soren. So the story started in 2014 when I was first diagnosed with a ovarian cyst and came to know about my grade 4 endometriosis. This was before my marriage. In 2016, I got married and we tried naturally to conceive for 1 year, but that didn't happen. So I started asking around for a good IVF specialist, and Dr. Tanya Bakshi was recommended to me.
Endometriosis is a condition where you can have cysts in the ovary which are blood filled, and sometimes, depending upon the stage of endometriosis, all the organs in the body can be affected, right from the tubes, right from the ovaries, and in some condition it is associated with an abnormality in the womb as well, and that condition is called adenomyosis.
She told all the pros and cons regarding the problem, and she even told that it will be very tough for you people also.
Minati also had certain medical issues. She was already struggling with her weight. She was a pre-diabetic, which then progressed to diabetes. She had problems with her blood pressure.
And my sperm counts were also on the lower side.
And we initially took our time to optimize the overall health. We had to optimize Minati's health, looking at her reserve of her eggs because she was already touching almost 37 years. And at the same time, we had to make sure that her diabetes and blood pressure were well controlled. Only when we are optimized, same time Madhu was given some medication and supplements to optimize his health and his sperm count. We worked on a regime of good diet, exercise, sleep is also important.
It was a 7 years journey to optimize my health and to improve pooling. And with that, the other issue was that my uterus was very acutely, the anatomy was distorted.
When Minati came, because her egg reserve was borderline because of her surgery for endometriosis, we had to do few cycles of IVF to collect her embryos, and we kept them in the freezer. Second stage Minati had to go for is a surgery for her endometriosis and for her uterus. This surgery is called hysteroscopy. Same time laparoscopy was done because her tubes were abnormal. And if the tubes are blocked and if they're abnormal, they even affect the success rate of IVF.
And the lining was not good. It was always a double lining uterus. So a special therapy was used that is called PRP,
where we take blood from the patient and it's prepared in the lab, then used to be pushed back into the lining or the cavity of the uterus to help with the growth of the lining, and at the same time improves the blood flow and the vascularity of the uterus. After optimizing her health, after optimizing the condition of her uterus, her womb, we then used our frozen embryos to be transferred back in her uterus in a process called a frozen embryo transfer.
And now I have a healthy male baby, 9-month-old, without any issues, and he's growing well. And today I'm also healthy and well.
So it was a very tough journey. In fact, I will tell it was kind of a roller coaster. And by the grace of God and Dr. Tanya ma'am's effort, finally we are happy parents.
So thank you so much, Tanya ma'am. Thank you, IVF team, Max Felicia.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.